Hi, my name is Will. I'm a level 2 nursing student at McMaster University, and today I'll be demonstrating how to give a subcutaneous and intramuscular injection. So before the actual administration and assembly of the injections today, I'll be first addressing the MAR to make sure that I understand the order and why it is being given. So first I'll be starting with the 8 rights of medication, so starting with the patient's name. So throughout the process, administration and assembling, making sure that this is the patient that is receiving this medication. So when I go in his room, I will be checking his identification, like his band, as well as the medication given, so addressing the MAR, and then when I'm assembling, making sure the medication is the same on both, and then the time and frequency it's to be given, the dose, so the concentrations, making sure that the right concentration is given, and then I draw the right amount of medication up, as well as the route. So after I assess his body type and his body build, I can better guess and pick where to landmark and administer the site, because there is variation based on body build. And then I should be documenting throughout my my process and after administration, and so I can say the time that it was given. I could also tell Mr. Mancini that he has the right to refuse the medication if he so chooses, as well as the right reason he's getting it. So today he'll be getting heparin subcutaneously. So this prevents clots from forming. So since he is post-surgery, this is logical, as he is most likely immobile and he is at risk for producing clots. And then the other intramuscular injection will be Haldol. So it's antipsychotic, but it also is used for patients with extreme agitation, which he could also be in post-op with things like extreme pain. And then throughout this, I could also address his past medications and medical history if there is anything that the MAR did miss, and that could, for whatever reason, complicate the administration of these medications. So we're going to begin by preparing the subcutaneous injection. So we can start by administering some hand hygiene. And then from there we can compare the needle and the medication to the MAR and make sure that the medication makes sense for the patient's condition, as well as the needle being used makes sense for subcutaneous injection. So it's at 25 gauge, which is within the range, and then the range is 1 to 3 milliliters for a subcutaneous injection, and this one is 1 milliliter. So we have the medication here, and this was the 5,000 units of heparin, and the concentration is 5,000 units per 1 milliliter, so we'll be administering 1 milliliter of heparin. So we can begin by popping off the cap here, and then we can clean that with an alcohol swab, going from in to out. And now while that dries, we can prepare the needle itself. So first we can open the syringe, top to bottom, banana, with the paper side up. And then we pull the actual syringe itself out, pulling back the plunger and testing to make sure that it works fine before we assemble it. And then to actually draw our medications, we'll be using a filtration needle. So just be sure not to touch the top there. Pull that out. And then with our medication, we will draw back the required amount. So for the heparin, with its concentration, we would like 1 milliliter volume to administrate the 5,000 unit dose. So we inject it into the top here, and then release the air into air. And then we can flip our medication and make sure that the needle tip is submerged, and draw back slowly the medication to reduce the amount of bubbles formed. A little bit of bubbles there. And there we have our 1 milliliter. We'll recap this filtration tip. place it in here and open up our syringe by applying our subcutaneous tip to the medication. And this makes sense considering it's heparin. It'll be long acting, so it would make sense to put it in as a subcutaneous injection. So after that, now that that one is done, we can prepare the intramuscular injection, which would be the Haldol. So since the Haldol is 4 milligrams per 2 milliliters, we're looking for a 1 milliliter dose. Then we will be administering half, or 1 milligram, sorry, we'll be administering half a milliliter of Haldol. So then we would grab our intramuscular needle, and once again, make sure that the gauge is appropriate and the volume is appropriate for an intramuscular needle. So 22 gauge and 3 milliliter needle. So that one there seems to be within range. And once again, taking the plunger and drawing it back, ensuring that it is functional. And then once again with the medications, I would clean the top, and as well as if I was in and out of the room between preparing medications, I would do, once again, hand hygiene. So now once again, just to draw our medications, I will be placing the filtration tip, filtration needle, and drawing back half a milliliter. And now I'll be pressing this in air, and pressing it in air while supporting it with my non-dominant hand, and then drawing up the medication and submerging it to draw back the required 1 milliliter. And then there's some air in there. Perfect. Then I can put the filtration tip back, and then I will apply the intramuscular tip to this needle. And then upon completing both medications, I would use a pen or marker and just mark down the patient's name and room number, so that when I do go to administrate the medications, I just have one more certainty to rely on that this medication is for the right patient. So now that we've assembled the needles and the medication and disposed of the soiled supplies in the proper sharps bin, we'll actually prepare for the administration of the needles. So we'll start with some hand hygiene. And then after that, we'll put on some gloves just before the administration. And then once that is done and ready to go, we will enter the room and we will examine the patient and ensure that this is the right patient one more time. So by comparing what I've written on the medication, Mr. Mancini, and then checking the patient's wristband, Mr. Mancini, yep, 100%. And then after that, just deciding, since we are doing a subcutaneous, which site to do, so based on his body build, as well as if it's within normal range for his age and gender. For this subcutaneous injection, we'll be doing an abdominal injection, as well as it could be the anterior portions of the thighs or the backside of the arm, but just for video's sake, we'll say it's the abdomen. So when landmarking for an abdominal injection for subcutaneous, it will be 2 inches from the umbilicus. So if we say the center of this pillow here is the umbilicus, so about 2 inches from there. And then before administration, you would use an alcohol swab and just clean that inside out. And then when preparing for the administration, you would take the gauze and put it between the fingers of your non-dominant hand, like so. And then grab the actual syringe. Like so. And then as it is a subcutaneous needle, I'll be coming down on a 90-degree angle. If the patient had less body fat around his abdomen, I would go at a 45-degree angle, but just for this case, I'll be coming down at a 90-degree angle. So I'll come in like a dart, and then appears. Administrate the medication slowly ready with gauze. And then I would highlight the gauze there and pull away from me. I would dispose of the needle in the sharps container. Then I would hold the gauze here for the allotted time. And then I could also gauge the patient on how they were feeling and how, just to kind of ensure and make sure there was no kind of issues, or like for the umbilicus when we were avoiding vessels, that no vessels were hit kind of thing. So for that was for subcutaneous, and now we will prepare for the intramuscular injection. So for intramuscular injection, you can do deltoid or the lateral aspects of the leg. Today we'll be talking about deltoid. So what's different with this one is once you inject the needle, you can aspirate slightly to ensure that you haven't gone into a vein. So I will be doing that once I administer the needle. But once again, I would do hand hygiene and put on gloves, and then I would start by coming into the room and then ensuring that the patient's ID matches up with whatever written on the medication and what the MAR says, Chauffeur, Mr. Mancini. And then from there, I would take my medication, and then I would once again, based on patient build, decide which landmark to use. And then, so for now we'll say deltoid, but if the patient was some low muscle mass on their deltoids, we would more likely use the lateral aspect of the leg. Once again, we're just going to clean our landmark site for injection. So you go to the clavicular line, and then you go 2 to 3 finger spaces down, and that would be your landmark site. So we have our intramuscular needle here. So once again, I would grab a piece of gauze, put it in between the fingers of my non-dominant hand, and then I would put the needle. Then once again, for an intramuscular needle into the deltoid, I'll be going in at a 90-degree angle. And I'll be coming in with gauze and drawing up, and then holding the gauze there for the allotted time while disposing of the needle in the sharps bin. And then once that is done, I will verbalize my documentation. So I have administered 5,000 units of heparin subcutaneously, and then 1 milligram of Haldol intramuscularly. I would verbalize the timing, so 9 p.m. February 9th, 2018, and then I would also state the site of administration. So for the subcutaneous, it was abdomen, and for the intramuscular, it was deltoid.